An adult, unconscious and not breathing. Adult CPR. So, first of all, you would come in, you would check for danger. You check for response. You speak and then you touch. No response at all. So, hello, I'm Emma, I'm a first aider. Open your eyes. Nothing. Nothing at all. So, check for danger, check for response, no response. Open the airway, you tilt the head, you lift the chin. And then to check for breathing, you put your cheek above their mouth and nose to feel them breathing against your cheek. You look down the body to see their chest movements, and you look, you listen and feel, and you're feeling for at least 2 in up to 10 seconds. There is no breathing. So this person is unconscious and not breathing. I now need to start CPR, cardiopulmonary resuscitation. When I'm pushing on the chest, I'm being the heart for them. So pushing on the chest is squeezing the heart and pumping the blood around the body. Breathing into them is reoxygenating them. People often ask about, can you just do compressions? You can do compressions and they'll probably give them about 3 to 4 minutes, because generally when an adult collapses, they have 3 to 4 minutes worth of oxygenated blood in their system. So if you are just pushing on the chest, you're giving them something, but to give someone the best chance, you would be giving the breaths as well. And you would always look to do that if you've been trained to do so, unless you're unwilling or unable to do so. To give the compressions, you're going between the nipples, centre of the chest, heel of your hand, and you're going to have to push hard. You're pushing down about 5 to 6 centimetres, about a third of the depth of their chest, but about 5 to 6 centimetres roughly. You're pushing down hard and fast. So 100 to 120 beats per minute, so roughly 2 per second. And you're going to be doing 30 compressions to 2 breaths. And when you're pushing down, you are circulating the blood. And you're doing 30 compressions. And I haven't done 30, but you would be doing 30 compressions to 2 breaths. And when you're giving the breaths, you tilt the head, you lift the chin, you hold the nose, and you breathe in twice, and you should see the chest rise. Two breaths, and then straight back onto the chest. And you would keep going. 30 to 2, 30 to 2. If you have a defibrillator, you should start using that as quickly as possible. So, just to recap, you've checked for danger, you've checked for response, you've opened the airway, you've checked for breathing. They're not breathing. At this point, you should be getting an ambulance on the way, and if you have somebody else, they should be getting an ambulance and a defibrillator for you straight away too. You would then start 30 compressions to 2 breaths. You keep going till the defibrillator arrives, and then you can start using that. And you don't stop doing CPR unless the casualty starts recovering. The paramedics arrive, you're using the defibrillator, or you are too tired to carry on.